Hey, it's Jennifer. It is April 28th, 2015. I am 3 years and 2 months out gastric bypass surgery. I'm about 10 months out gastric bypass revision. It's been a while since I made a video, so I don't remember what I talked about last time, but I had an update, so I thought I would update. I've made this video like 6 times, so that's why I'm talking fast, because every other video ended up being way too long, and I rambled, like I do. And that combined with the stupid cough that I have, which I assure you I do not smoke and I am not dying, although it sounds like both are happening at the same time when I cough. I just had to remake the video. So, long story short, all this talking that I've doing about plastic surgery, it's coming true. June 4th, I am having my arm lift and my tummy tuck done. They will be done the same day. My plastic surgeon is someone who works in conjunction with my weight loss surgery center. So he's somebody who specializes in bariatric patients. I'm very, very comfortable with him. I think his work is amazing. I'm very excited. Let's see what else. When I seen him earlier in January, I couldn't get approved for financing at first. I had to do a lot of work getting my credit in shape, but I was just approved last week for financing. So this is all kind of like new information. When I had my consultation, I got 2 different quotes. I got one for the arm lift and breast lift. I'm sorry, the arm lift and tummy tuck as one surgery, and the breast lift as a secondary surgery. I'm choosing to do the arm lift and the tummy tuck first, because I think it's the best use of my money. Tummy tucks are typically covered by insurance. My arm lift is not. The tummy tuck for my surgeon includes, obviously, the stomach and liposuction, but then it also includes the muscle tightening, which some surgeons charge extra for that. Mine does not. So everything combined, the anesthesia fee, the hospital fee, the surgeon's fee, the surgery itself, everything combined is $8,600. So that's what I paid. That's what I'm financing anyway. What else? The surgery itself, my stomach will take about 3 to 4 hours, and the arms take 1.5 hours each. So they said I'll be in surgery about 7 to 8 hours. I am his only patient that day, for good reason. I will be having it done at the same surgery, at the same place where I had my bypass done and my bypass revision done. So it's not a hospital, it's a surgery center, which I'm actually a lot more comfortable with because the people staying there aren't sick. They just had surgery. So to me, there's less risk of infection, of catching an infection, because nobody in the hospital's sick. They just had surgery. So I've been there twice before, so I kind of know how it goes. They said I'd be in the hospital a day or 2. I'm going to assume that I'll be there for 2 because A, it's such a big surgery. B, I have asthma, so they always kind of keep me a little bit longer because they have to make sure that I can breathe. Which if I was there right now, they wouldn't even do surgery because this has got to get, my chest is so congested, it's got to get cleared up before I go to surgery. And C, my blood pressure is so low after I get out of surgery. I don't expect that to be any different this time, especially because I'm under anesthesia so long. The last time I was under anesthesia that long was for my back surgery. And that was like a really, really big deal. So this is a big surgery. I'm not saying it's not. I'm just not scared. I'm not at all afraid. I'm not even going to have anybody at the hospital with me. I'm just going to have like somebody drop me off in the morning and then they can go do what they want to do. The surgeon's office said that was fine as long as they have a phone number to call at the end of my surgery to let them know how surgery went. So I'll just give my mom's phone number and they can call my mom when I'm done. This is my 7th surgery in 5 years, so I kind of know how this goes. If something were to happen, my family can't go back there and fix me anyway. And if everything goes well, as I presume it will, I don't want them to waste 7 to 8 hours of their day sitting there for what? Like, it's a waste of time, and it's just not that big of a deal to me. So let them live life, and my surgeon will call and be like, hey, she's high on morphine, everything's cool. I'm like, that'll be that. I'm not going to remember anything anyway. I don't even need anybody to visit me that day because I won't remember that you're there. So I'll just have somebody pick me up at the hospital like a day or two and take me home. That's the part I'm scared about, is the coming home, because I don't have anyone to take care of me. I know a lot of people, you know, my age or older, or I guess it's not even an age thing. I know a lot of people who have plastic surgery, especially when they have more than one area done at the same time. You know, their husband or their wives take care of them, or, you know, they go to their parents' house because their parents are retired and their parents could take care of them, or their parents could take time off work, or whatever the case may be. I don't have that option. That option is not available to me. My mom's going to have Tori because I'm not going to be able to watch her. And she's really, really, really busy with her own business. You know, she's got her own business, and she has to work every day to keep up her clientele, and she's really, really good at what she does. So that's not an option. My sister works, my stepdad works, I'm not married, I don't even have a boyfriend, so, my dad doesn't live in the same state. I don't have anyone. Like, I don't have, like, I have friends, but they're the kind of friends, like, I see, like, once every 3 years. My older sister, who I really didn't talk to for, like, 4 years, we just kind of reconnected over Halloween. She used to be a CNA, and she's not working right now, so she said she would come check on me, like, once or twice a day, which would be helpful, because according to my surgeon's office, I just kind of need somebody here, so that I could take a shower, like, just kind of have them here in case I get dizzy or whatever in the shower. That I'm going to need someone to cook for me, which I don't cook, so I'll just need someone to bring me food. And then I need someone to feed my cats, because I'm not going to be able to, like, bend or anything like that, or really, like, move my arms, really, for a couple days. Maybe a week or more. I probably won't be able to do much with my arms. And with being my arms and my entire, everything from my hips up, really, I'm not going to be able to function. So, and I'm going to be in so much pain that I really just want someone to help me get my meds. And, I mean, I don't know how to let people take care of me. I just know I'm supposed to. I'm not going to get into it. So that's the part I'm scared about, is the recovery part. When I had my back surgery, I recovered on my own in my house. I've never had anyone take care of me during my surgeries. I've always had somebody stop in 10, 15 minutes and then go. So that's what I'm used to. I'm pretty sure that I'll be fine. But a lot of you are telling me, like, no, you're not going to be fine. That's the part that scares me, because I can't do anything about that. So I've looked into hiring, like nursing, like at-home nursing, but my insurance won't cover it, so it'd be private pay, and when I say I'm paycheck to paycheck, I am paycheck to paycheck, and missing 4 to 6 weeks off work. I don't get paid vacation time. I don't get paid medical time. My job is awesome. My boss is awesome. My coworkers are cool. I only work with 3 other people, and I consider them truly all friends. And it was really, really cool that my boss, without any issues at all, gave me this time off and is as excited for me as I am for me to have the surgery done. So I'm very, very blessed there. But I don't have, like, the luxury of having this time paid off. So I can't afford to hire someone to come take care of me. That's really the only thing I'm scared about, though. I'm not afraid of the surgery. I'm not afraid of anything else. I don't know. If you have any other questions, like, I'm totally fine talking about this in terms of if you want to know, like, details and costs or recovery time, or, like, hopefully I'll be posting after to kind of, like, let you guys know how it went and all that kind of stuff. I'm not as open, I will say this, I'm not as open about talking about the plastic surgery as I was my bypass or my revision. I was very proud to have weight loss surgery, so I told everybody about it, and I have always been very open about it. Friends, family, coworkers, friends of friends, coworkers of coworkers, like I would tell anybody. And I lost over 120 pounds. I've maintained a loss of over 100 pounds for the past 3 years. So plastic surgery for me is a good option at this point in time. I'm proud of the success I had. I know people look at me sometimes like, you had weight loss surgery and you're still this big, but they didn't see me before. They didn't know about my health before. My bipolar got a lot worse after surgery, and my PCOS got worse after surgery. And they're still not good. But all the other health concerns and health problems that I had are completely gone. So to me, surgery was a success. My revision, to me, it wasn't a success or a failure. I lost 20 pounds, I regained 15. That just tells me my body is at its comfortable point. Speaking of which, Pound of Cure, Matthew Weiner, Dr. Weiner. You need to read this book because that whole calorie in, calorie out nonsense is a bunch of bullshit. It's not true. He explains why. He explains how your body resets itself after surgery, how it has a set point weight that it wants to be at, why you could exercise for 4 hours and eat hardly anything and still not lose weight, or why your sister, who is a size 2, could eat way more junk food than you and she never gains weight. It's all in here. It's a very, very good book. He actually has a YouTube channel, too, that explains all this. If you'd rather watch videos, if that's how you learn is through video and audio, you can watch those as well. So, anyway, I forgot what my point is. And then I'm going to go back and watch this video and be like, oh, that's where you were supposed to care. That's where you're supposed to talk about. Completely gone. Oh, the plastic surgery and the weight loss surgery. And it's that point. Gotcha. I'm back there. I got it now. I don't consider my revision to be a success or a failure. It's just my body's comfortable where it's comfortable. I'm never going to be thin. I'm never going to be like skinny. This is always how I'm going to be. However, the excess skin can like, I'm so over it. I know to a lot of people who just see my body, they don't realize how much of that is excess skin because it still kind of looks like fat in a way when it shows up through clothes and things like that. But I even asked my plastic surgeon, like, how much of this is actually excess skin and how much of this is just fat, because I'm still overweight. I was told 10 to 12 pounds. So that's a lot of excess weight. And my arms I'll be so happy to have my arms done because I can't even wear short sleeve shirts without being so self-conscious that I am literally in tears. Like literally crying because I'm so embarrassed. And I'm so afraid of what people are thinking and what they might say to me, because people have said, strangers have said such cruel things to me when out in public. Things that I would never think to say to somebody. Even if I knew them, I wouldn't say that to them. But people, when you're super morbidly obese, they don't see you as being a person. They just say what they say. So I'm extremely self-conscious about my body. So having the surgery done is going to be like a breath of fresh air for me, and it's going to feel like I look on the outside like I feel in the inside. However, back to why I'm not comfortable talking about it is because I think there's more expectations and there's more of a stigma when you have plastic surgery, because people kind of expect you to come out of it looking a certain way, and then you got to maintain that, and blah, 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 blah. And, you know, when I get out of plastic surgery, I'm probably going to need a lower body lift. My surgeon, his definition of lower body lift would be the hips and the butt and, like, the thighs. Not every plastic surgeon includes the same body parts when they say lower body lift or 360 body lift. So ask your surgeon what they do for their lower body lift, or what order they do the body parts, because not everybody is the same. But that's what my surgeon does. And he told me that when I have the tummy tuck done and the arms done, that somehow, like, it naturally affects the hips and the outer thighs in a way, so that I shouldn't worry too much about looking like bottom heavy after it. But I know I'm still going to, because I have really, really, like, chunky thighs. And I have, like, the most ghetto-rific booty ass ever. Like, white girls should not have this much butt. Just saying. But, So I do. So I know I'm going to look a little, maybe weird. Maybe, I hope I don't look weird. I hope I don't look weird. But I'm going to look different. And the number one thing that I'm most afraid of is going back to work. Because I work with all guys, and I work with primarily senior citizens, and both of those demographics of people have no problem telling you what they think about your looks, like, at all. And it's going to be such a dramatic difference. And they're expecting it to be a dramatic difference. And that's, the expectation part is what kills me. Like, because I don't want to, I know I'm not disappointing anybody, but I feel like I have to live up to some kind of expectation of, like, beauty all the time. And I don't, not gonna cry, and I don't. So, I don't expect to after plastic surgery, but I don't want them to think that I'm going to either. So that first day back when I first walk in the office and everybody sees me, I'm just like, I really just want to, like, hide and, like, just go to my desk and do my job. But, so I'm worried about that. And then I'm worried about, like, Christmas and when family sees me for the first time. And I'm worried about people saying, like, or thinking that I cheated because I had plastic surgery, because it's not like cosmetic surgery where I'm going in to fix these parts of myself because I don't like them, or to make me better, or it's going to make me pretty, or I'm doing it because I don't want the excess skin anymore. It really literally weighs me down. It is horribly debilitating, and unless you've had weight loss surgery, and unless you have 10 to 12 pounds of excess skin on your stomach and your arms, you don't realize what it does to you. Not just physically, but mentally and emotionally too. So, this video is still 17 minutes long, but you could cut out the last 10 minutes and you'll be fine and get all the information. So, anyway, I'm going to go now. I'm going to shut up. I got to go to school soon. That's the other thing is, I still got to go to school after surgery. Like, I can't go the first week. But I'm going to have to find a way to get to school, and I want to go back to work sooner than 6 weeks, because I really am grateful that they gave me any time off at all, and I really love my job, and it's only 4 hours a day, so I should be able to do that, but I'm just like, I'll have to see how I feel after surgery. But, so that's that. I'm having plastic surgery, June 4th. At any rate, I'm going to shut the hell up, and I'm going to go. Thank you very much for watching, and I didn't cry. I made a video where I didn't cry. I almost cried, but I didn't. I should get an award for that. Anyway, I will talk to you guys later. Thank you so much for watching. Sorry, again, that this is so long. If you have any questions or whatever, go to the YouTube page and put them in the bottom, and I will answer every single one. I will talk to you soon. Thanks for watching. Bye.